Welcome to Keep Talking, a podcast by the Mental Health Foundation of Nova Scotia. I'm your host, Sam Madore. Keep Talking is all about having honest conversations around mental health, lived experience, and hope. In this episode, we're joined by Seana Jewer, Community Engagement Lead with Roots of Hope at Nova Scotia Health. Later in the episode, we'll continue the conversation with Foundation's President and CEO, Star Cunningham. I'm so glad you're here. Let's keep talking. Please be advised, this conversation may contain discussion of suicide. Seana, I just want to start with a question. Just for anyone who's listening who is not familiar with the work that you do, are you able to give us sort of an elevator pitch of what Roots of Hope is?
Yeah, absolutely. So Roots of Hope is a community-based initiative, which is all about supporting folks in community to build their capacity to help those that are thinking about suicide and or grieving from suicide.
You really do have an elevator pitch. I like that.
Yes, yeah. And it's a complicated thing, so trying to snap it in is it's challenging, but I got there.
Yeah, and it's such an important program. And how did it come about?
Well, it's part of an initiative through the Mental Health Commission of Canada. So the framework or guiding principles for Roots of Hope comes from the Mental Health Commission, who had spent some time looking at what is impactful in community. What can we do at the community level to help support those that are thinking about suicide, those that are grieving? They came up with this framework and then initiated different pilot sites across the country. So Nova Scotia was one of the earlier sites. So Roots of Hope has been around since 2017, and we started becoming active within 2021. And really it was just acknowledging that there is a role community plays in supporting those folks that are having challenge connecting back to life, for those that have lost somebody to suicide, and acknowledging that while the mental health care system plays an important role, it isn't the only role.
Knowing that you have a spot in community and have a voice in community when you're grieving, I think is so important.
Yeah.
You're reminding me, and I actually wrote this down. So you've done a bit of work with our grant lead, Monica, and I was chatting with Monica, and you're going to love this. I love it. She said, I think Seana's role is empowering and inspiring communities to take action. And I thought, man, does that ever sum up what you do?
Yeah.
I think that's such a really concise and nice way of describing what it is that you do in community.
Yeah. And it really is about helping folks in community where suicide has impacted them in some way, whether they're a caregiver supporting somebody who's thinking about suicide, whether there's somebody who's been thinking about suicide and who's in a really great space right now and wants to help others, or people who have lost someone to suicide and want to try to create spaces and awareness so that people don't have to have that experience themselves, and just helping mobilize that, create space for that. It's a pretty overwhelming space to be in. And many folks are doing some really incredible work without professional degrees. They're not mental health clinicians, but they are creating spaces in our community that folks can feel safe and build their understandings of how to support one another.
And how much does lived experience come into play in those situations when you're talking about folks who who aren't clinicians who are doing that? Are they often folks who have lived experience with having lost somebody to suicide, and so they've taken on that role?
Yeah, it's huge. I think that it has been kind of the driving force in a lot of the work that Roots of Hope does. And so when I first started out, it was 2021, fall of 2021. So we were nearing the end of our pandemic without really, I think, knowing that we were nearing the end, right? We were still masking. There was still a lot of people were not necessarily gathering in public spaces and this sort of thing. And so coming into it, it was like, where is the energy to do suicide prevention work? Because people were feeling really burnt out within the healthcare system, within communities, community organizations who had just done such fantastic work, supporting communities. So you're talking about a really tough topic, a topic that people don't have a lot of experience in. So where's the energy? And the energy came from people who were impacted by suicide, whether they lost to suicide or had been supporting people who are thinking, or in our supporting people who are thinking about suicide. So they're like, we need to do something. We need to understand how we can do this better, right?
How important is that perspective when you're having these conversations in community?
It's huge because suicide is so complex. There is not one solution, not one answer that's going to remedy everything, right? And the journey that somebody has in understanding that their life is not worth living anymore to themselves is so individual. So to understand, how do we prevent suicide, right? How can we create life worth living for somebody is an individual journey for everybody. So having folks that are walking those journeys is huge in informing, okay, what's going to be helpful.
I went to one, and I don't know if it was specific to suicide. It was a grief conversation that you, and I believe you were partnering with Canadian Mental Health Association. I feel like the best thing about that particular setting was that you could sit back and watch and listen and be a part of it without speaking or coming forward. Or you could have an opportunity to tell your story or share in that. And it was just a nice feeling to know you were safe either way. And I feel like that's something that comes out naturally in those community conversations.
For sure. I think what you're picking up on, Sam, is that people approach things in different ways, and what feels right in a certain moment changes, right? Can change on the space we're in, the people that are around. So that's why there's no like absolutely right thing that everybody needs to do, whether you're working through your grief or whether you're working through understanding coping skills with your suicidal thoughts. Like, everyone's different, right? So creating space where it just meets you where you're at, right? And is not prescriptive. Like, this is what you must do,
Right. Yeah. Nobody wants to hear the shoulds or the musts when they're grieving, right?
Yeah. Well, especially when you haven't walked their journey, right? And sometimes I say it like this way too, I could think of 100 million reasons for a person to live, but I am looking at it through my eyes with my gifts and saying, this is how I would work through your life.
Right.
But obviously, that's not the way it is. That person had to walks through this life with their gifts, right? So understand their own gifts, using those gifts and figuring out how to connect back to life is huge.
Oh, man. Yeah. And you have this way, I'm just going to talk about you for 1 second, Seana. Okay. You just have this way of connecting folks. So I've been in a lot of meetings that you've been a part of, and you're kind of at the center, but you're not taking space, if that makes sense. You're able to allow folks to speak and feel comfortable and connect folks to where they need to be in that moment.
Letting go of control, right? That has been a big thing. And anyone in a leadership role feels a sense of control, responsibility, accountability for what's happening, but acknowledging what you don't control and letting it happen is like a huge release. Yeah.
Which ties in so nicely with the work around suicide as well, because think about a caregiver who has lost somebody to suicide and how there's absolutely no control over that situation, and how that kind of ties into the recovery side of things too.
Yeah, absolutely. As a caregiver, coming to terms with the idea that you do not control the outcome, right? And there's an expression, I don't know if I'll try to say it correctly, but if love could have saved them, they would still be here. Because people come into this with so much love, so much compassion, so much wanting a person to stay on. And again, because we don't walk in those person's shoes, then we have to let go of that control. And it definitely impacts the grief journey, depending on how far along a person is with that idea.
Right. It's so hard to do. It sounds so simple. It's so hard to let go of that control, or feeling like you should. Again, I'll go back to that word, should have been able to do something.
Yeah. And the person who's thinking about suicide, right, they also need us to let go of that control. Because who wants to be controlled for the rest of their life? Who wants to live this life feeling like they have to have this circle around them watching, making sure that everything's okay, making sure that you're safe? That's not a way to live a life, right? So we have to let go of that control in order for them to gain control over their own life. Also, for a person thinking of suicide, what can come up for them is that feeling of being a burden.
Right.
And so if we as caregivers are constantly focused on our caregiving role, and we can't do things because like I can't go on a vacation. I can't work outside of my home. I have to be, check in 3 times a day,
Right.
all that sort of stuff, right? To try to control a situation that we don't really control. We are also not taking care of ourselves.
Right.
And that's witnessed by the person that's thinking about suicide. They see what you're doing, and they see, and it's all out of love often, right?
Yes.
And it's not helpful. Right? So we have to take care of ourselves, and that also helps relieve that sense of being a burden to anybody else, right?
It's so interesting. And yes, you're absolutely right. And, it's that thought, how can I help? And in some cases, taking care of yourself as much as it doesn't feel natural, taking care of yourself first is sort of the best or only way to help in some cases.
Well, in role models too, right?
Fair, yes.
So if we're supporting somebody that's thinking about suicide, like them seeing us also do what's necessary to connect back to life, right? Even those simple things like stopping for lunch, making sure we get outside for some fresh air, taking a break, relaxing, because with folks that are, maybe in that position of thinking about suicide may not think that they're worth any of those things anymore.
Right.
Our self-esteem can go so down and can be so low that it's like, what does it matter anyways, right? But those things do make a big difference. As hokey as it kind of sometimes sounds, right? But it's those little things and accumulation of that stuff, right?
Well, the little things added together are big things, right? And I mean, even on their own, little things can be big, can feel big for sure. What does somebody do if someone's struggling, with suicide, not the caregiver, but the person themselves? What are the steps that they can take, manageable steps that they can take when they're feeling that way?
It can look different for everybody, so I'll try to share things that maybe many people will connect with. But the first thing I think is having a circle to talk to, having people to connect with, to let them know when you're at your lowest to lowest. Because if those feelings get activated and they start rising, being around somebody else will help. They may not do anything, but just knowing that, that you're present with somebody is hugely helpful. Understanding where the thoughts are coming from, like what is activating you, right? What makes you start going down into that slippery slope, right?
Yeah.
And catching yourself, right? One person shared with me that when they have thoughts of suicide, it's their little reminder something needs to change right now.
Okay.
Right?
Yeah.
Something needs to change right now. So that could be a simple change, like I'm with my family right now. I don't like where this conversation's going. They're not making me feel good right now.
Yeah.
I need to change. I need to get out of here.
Yep.
Right?
Need to go for a walk.
I need to go for a walk. Yeah. Because, sometimes we're, in spaces where people don't feel good, right? It could be a meeting, right? You're at work and you're in a meeting and it's just not feeling good at the moment. Or it could be bigger changes, right? It could be a relationship that's not working out. It could be a, work situation. I need to change where I'm working.
Right.
I need to reconnect with my purpose. Right? When things are not aligning, that sort of thing. So that's a big thing. And then finding ways to distract, knowing what your distractions are. That could be music. It could be a movie. It could be cooking, It could be whatever, just something that puts you in a present moment. Because when we're in those thoughts of suicide, we're often thinking about the past.
Right.
We're thinking about all of our challenges that we've had through life. We're thinking about all the mistakes that we've made, all the regrets, the bridges burned, the people who won't engage with us anymore, right? So doing something that focuses us in the present can be super helpful.
And being able to establish those when you are in a clear headspace. And I certainly don't want to make this sound like it's easy, because it certainly is not. But establishing what those go-to things are going to be when you're in a clearer headspace, who those go-to people are going to be when you need to talk to somebody or whatever. It's so important to establish those, I would imagine.
Absolutely. And I thank you for bringing up this point too, Sam, because when we talk about suicide prevention, we're often thinking in crisis mode.
Right.
Right. And the reality is suicidal thoughts are not always in crisis. They can be present, they can be slightly lingering, they can be super active, right?
Right.
But yeah, thinking about these things when life is feeling a bit more calm and able to kind of just think about who are my people.
Yeah.
Right? Who gets me? Who's not going to be freaking out about this, right?
Yeah.
What are the things that I enjoy doing? What makes me feel better about myself, right? What do I need in this moment, right? And, understanding those boundaries, like if you need to rest, you need to rest, right? We live in this society that, push through, go till you crash, right? And that's not good for everybody. It's not good for anybody. But for some people, it's really not good, right? And just acknowledging that and being okay with the fact that, boundaries have to exist sometimes. Yeah.
And are these the kind of conversations that happen in settings that you've been a part of through Roots of Hope? Are they just authentic, open conversations where folks can share these thoughts and feelings?
Yeah. So it's like, really about creating that awareness and reducing the stigma about it and kind of normalizing the conversation.
Yeah.
Because I think no one, I really struggle I'll say it like as this way, no one really goes through life without some sort of challenge. I've yet to meet that person, right?
Yes.
And whether it's a big challenge, small challenge, it's all up to, how that person is and how it's landing with them and what they have with resources and supports to get through challenges. But we all go through life and have challenges. And how often do people think, I just need this to change. I just need things to get better. I don't know if I can do this another day. Or someone saying, I don't know how she gets out of bed. Right. And so it's those challenges happen, right? And when we have the supports and resources, we get through those dark times.
Right.
And we get through them and we get to the better side of it, right? When somebody is thinking about suicide, they are running out of resources. They're running out of supports. And often we don't know that suicide is even on the table.
Yeah.
Because many people go through many difficult things. Many people have thought about suicide and have never said a word to anybody. And that was a moment that they had and, or they still have, but they just have been able to figure out how to stay connected to life.
You have been part of some funding through the Mental Health Foundation. How has that benefited Roots of Hope, directly or indirectly?
Yeah. Part of the work with Roots of Hope is about empowering communities, and they'll have an idea of something that they want to do. And getting past that, I'm not the right person, somebody else should be doing this, I'm not trained to do this, they have kind of gotten through that part of it, but then it's like, how do we make this happen? How do we create these spaces? How do we create these moments, these events? The support that the Mental Health Foundation has given has been crucial in helping shift that narrative around you have to be a mental health professional. You have to be a clinician. You need to be trained, in that. And not to say that the work isn't something that's done with care and a lot of mindfulness. And it's about creating connections in community.
Yeah.
It's about creating compassionate communities for folks that are really struggling with something that is highly stigmatized. And that funding obviously reduces the barrier financially.
Sure.
But more so shifts the confidence for folks to say, not for the person receiving the funding, for that group that's receiving the funding, for sure, that's a real confidence boost, but also for the community to know that the Mental Health Foundation is supporting this initiative brings credibility and integrity into the work, right?
What a great point. Yeah, that's a great way of looking at that. And that's all across the province as well, hey? Yeah.
And people need that sometimes to get through the stigma of it, right? Because it's like letting somebody know that you're thinking about suicide or that you're a caregiver of suicide or that you've lost someone to suicide, takes a lot. And why do that if you don't think the help is going to be helpful, or if there's no help to be had? Right? Why would you share any of that with anybody, right? So with the foundation support, it lets people know that these folks think it's going to be helpful. Maybe it will be helpful.
Oh, man. Wow. That's really well said. Mm-hmm. Seana, do you have any, I've been asking every guest this question, do you have things that you go to? I mean, you work in a heavy field, really, and when you're feeling low or you need to find joy, where do you turn? What do you look for?
People comment on that all the time with me. Wow, it's such heavy work you do, and it is heavy for sure. And there's a lot of great energy with it as well, and helping create hope in communities and supporting folks it is amazing. And yeah, taking care of myself is really huge. So it was probably, I was in my late 30s when I started having panic attacks.
Oh.
So this was well before I started suicide prevention work. And, for a variety of different reasons, I was reacting and my body was reacting with panic attacks. And the thing with the panic attacks is it's not really in reaction to a thing. It's not like you see something and you start to panic, right? It just comes
The why is often buried far away. Yes.
Absolutely. And so when it first started happening to me, I honestly thought I was just physically ill. And I didn't realize I was having panic attacks. And then they kept happening and then happening more frequently. And then I started clicking things. I'm like, wait a minute, right? You're, dealing with a lot. I was a relatively new mom. I had my kids at 35 and almost at 36. So new mom, working full time, just dealing with a lot of stuff at the time. And so I was like, so when I recognized and understood them to be panic attacks, then I had to learn to get calm and understand when it was coming on, like what was my body doing? What was I feeling, right? So for me, it's like tingling in my fingers and in my toes.
Interesting. Yeah.
And for me, I start feeling nauseous. I'll start feeling really warm. Yes. And I actually my scalp gets a little itchy if it starts really progressing. Yeah. And so these are things just for my body,
like physical.
Correct? Things that manifest, right? Because I'll be like, I've coping all day. Because mine would happen in the evening, right? When things would start to wind down, right?
Yeah.
So because I had that experience, right, I learned to be much more mindful of my body, right? Mindful of when my body's holding tension, when my body is feeling the energy, because I do get a lot of disclosures. I get a lot of texts and emails and phone calls from community members who are saying, this is going on. What should we do? This type of thing. They can come out randomly. Like, you never know when you're going to get one. So when I'm holding that, and as the day goes on, like I take time throughout the day. I focus a lot more on my breathing.
Good.
I focus a lot on making sure that I take breaks, eat well, eat what I want to eat too. I enjoy things. And having routines to help wind down at the end of the night, a lot of stretching, this sort of thing. And these are things, Sam, that I never did in my early adulthood, right? Yeah. And when I think back then, what did you do to take care of your mental health earlier, right? There were things that I did, but I feel like the world's heavier now.
Yeah. And being mindful of what it is that does support you in those moments.
Yeah, absolutely.
That it is breathing, that it is taking breaks and all of that.
Don't wait. Don't wait to take the break. Don't say, I'm going to plow through and then I'm going to go on vacation.
Yes.
Right? So people will comment about how busy I am, and it's true. I am super busy, but I have some rules that I have in place is one is energy matching. So if I'm working with folks, right, I'm matching the energy, right? So something might need to get done, something may be really important, or I may be even really super excited about it. But if the people around me are not matching that energy, then I back that energy down.
Oh, interesting.
Right? So that it goes at the pace that they want it to go
Yeah.
too, right? Because if my energy is like super hyper vigilant, right? And I'm like, go, 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 let's do this. That can be very overwhelming, right? And then it can also be exhausting. I don't put a lot of energy into convincing people to do anything either. Right? So there's tons of people that I just want to shake and say, let's do this. We should be doing this. Come on. Mm-hmm. But they don't have any energy for it.
Right.
So I don't spend any energy trying to convince them that that's what they should be doing.
Oh, interesting.
Right?
That's quite a skill.
Yeah.
Yeah.
But it helps.
amazing.
It's what keeps my energy going and keeps me able to do as much as I do. Because people
Yes.
say like, well, how do you do as much as you do? But
Without exhausting yourself.
yeah. The other trick that I have is I don't have to be 100% with everything all the time. Mm-hmm. So when somebody needs or wants something from me, because I have a hard time saying no.
I can't imagine. I can't relate to
I know
that
that
at
there's
all.
others out there, right? We like helping people, but I learned it doesn't always have to be 100%. Sometimes my 80% is just what that person needed. Sometimes my 60% is all that they needed.
Oh, that's great.
And if my 40% is not what you need and it's not enough, then that's all I have. And
That's
just be
right.
very clear, like that's all I've got right now. So you can have it or you don't have to have it, and that's okay.
Oh, that's amazing. That is really cool. Thank you so much for this chat. This has been a really great, inspiring conversation.
Thanks, Sam.
We're continuing the conversation with Seana Jewer with Star Cunningham, President and CEO of the Mental Health Foundation. Hey, Star.
Hey, Sam.
Just had a great chat with Seana. Seana, who of course works with Roots of Hope and who has received funding through the Mental Health Foundation of Nova Scotia. And I have to share this with you. She used the word credibility, and I just knew you were going to love it.
That's a great word.
Because, and in her words, it's when the Mental Health Foundation funds and supports these programs that are happening all throughout the province, or through Roots of Hope or through whatever program it is that it's supporting. She says that adds credibility to the people who are organizing them, but also to the folks who are showing up in community to say, if this is helping, if the Mental Health Foundation thinks this can help them, then it can help me.
I love that. That's exactly what we hoped would happen when
Right.
people were getting our grants and people were talking about our grants in community, that it would lend an air of credibility and let people know that it's kind of a stamp of approval
Yeah.
from the Mental Health Foundation. And it's a good reminder to us that the work we're doing needs to be amazing and incredible in every possible way, because our credibility, what we do, has such an impact on everyone else who's using our name and receiving our funding and providing services in their communities or receiving those services.
Yeah, it works both ways.
It does.
Because you also don't want to put that stamp on it if it's not going to, if the work isn't going to be impactful or have equal credibility on the other side.
Exactly.
Yeah. Oh, that makes sense. Yeah, it was a great chat. And, you know, it's so great talking to folks who are just so passionate about the work that they do. And of course, suicide prevention is a heavy topic, but just the conversations that Seana's able to have in community and that calm that she's able to provide to folks who are struggling, I think is key.
And Seana brought a lot of collaboration to the foundation. So she really worked with several groups to bring them together to optimize the grant funding. So Seana is a wonderful example of collaboration and community at its best.
Awesome. Well, that's great. Thanks, Star.
You're welcome. Thank you.